Yes, great.
So, hi everyone. Thank you for joining us today. For those of you who don't know me, I'm Professor Samantha Thomas. I'm Professor of Public Health at Deakin University and Editor-in-Chief of Health Promotion International. I'd like to start by acknowledging the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land from which I am speaking to you from today in Melbourne, Australia, and also to acknowledge the First Peoples of wherever you are joining us from today. So this webinar reflects on the evolution of global health promotion through three landmark frameworks: the Ottawa Charter for Health Promotion, the Shanghai Declaration, and the Taichung Health Literacy Statement. Together, these documents trace an important shift from establishing the conditions for health to recognizing health literacy as a core enabler of equity, participation, and systems change. So today's discussion is hosted by the Asian Health Literacy Association and aims to provide some more information about the Taichung Health Literacy Statement, which was recently published in Health Promotion International. The statement was the result of discussions from over 300 people from 21 countries at the AHLA Conference in Taichung. So today we bring together some of the authors of that statement who are distinguished professors and experts from around the globe. From Taiwan, we have Professors Peter Chang and Tien Van Dong and Terence Min Che. I think maybe later from Indonesia, Eni Rahmani will be joining us, and from Belgium, Stefan van den Broek, and from Israel, Professor Diane Levin-Zamir, and myself from Australia. So we're going to explore why the Taichung Statement is important, how it connects with existing health promotion frameworks, and how the statement can be used to drive meaningful action in policy and practice. So first of all, let's look at the big picture. To start us off, I'd like to invite any of our panelists to really briefly reflect on the Ottawa Charter and the Shanghai Declaration and the Taichung Health Literacy Statement, and to talk a little bit about how they might build on one another in advancing health promotion and why health literacy has become so central to health promotion over the years. Diane or Peter, you might like to start us in thinking about that. Diane, would you like to start, and then we can maybe see what other people have to say?
Okay, my pleasure. Nice to see you all. Thank you so much for organizing this special webinar, very timely, as we're just coming off of the Taichung conference of the Asian Health Literacy Association, and also wrapping up a very active year for health promotion and health literacy around the world. I'm Diane, a professor of public health at the School of Public Health in the University of Haifa, and also the policy chair for the national chair of the National Policy Council for Health Promotion in Israel, and also leader of a working group on the International Union of Health Education and Promotion for Health Literacy, and also associate editor of the Global Health Promotion Journal. So putting that all together, which is what I like to do when I speak about these important documents, is that I think we're seeing a wonderful progression. And thank you for the question, Samantha. We're seeing a wonderful progression as we celebrate 40 years of the Ottawa Charter, where health literacy was first mentioned in a very major way, in a significant way, in regard to health promotion, acknowledging the importance of people's skills to be able to promote their health, for empowering people with tools and with the skills in which people can use health resources, health promotion resources like information and other resources. Plus, in the Ottawa Charter, we have a very specific mention of settings, of health promoting settings. So when we launch our discussion of 40 years or even longer, we look at what the Ottawa Charter gave us part and parcel of the concept of health literacy, and also where it can be applied within the health promotion concept, for example, settings where we want to meet people where they live, love, work, love, and play. So I think that's we can really acknowledge that as far as the question, Samantha, on the Ottawa Charter. In Shanghai, the WHO, again, it was a WHO initiative. We looked at health literacy also vis-a-vis the urban settings and others as well, and really looking at the way in which we see health literacy playing out in many different areas of intervention and policy. There's a significant emphasis on policy in the Shanghai Declaration. And moving into the Taichung, I'll try to be brief, moving into the Taichung statement on health literacy and the conversation, the dialogue we've had leading up to it, we're really here acknowledging some of the most important and relevant and updated issues we're dealing with health literacy that help us cope in health promotion and public health and self-care in general. And that's looking also at the addition of the challenges of digital health literacy, of AI, and also looking at the issue of health literacy as far as the importance of health literacy as a human right, which is really being worked on in many different parts along the globe. And also looking at the issue of where AI is challenging us. And it's really a game changer for many of us and for the world as far as health literacy. So moving from the Ottawa Charter through Shanghai up to Taichung, we're looking at what the world is going to be offering us as far as opportunities for improving health literacy, but also the challenges, and where we want to bring critical digital health literacy into the focus, into the discussion. In addition to capacity building and training, because of organizational health literacy that is really helping us take the burden off the individual and bring the action by organizations really related to health literacy, including capacity building and including policies. So I think just in summary, we're seeing a really nice progression, an important progression that highlights where we began, where it's progressed to, what the new challenges are, and where we need to go forward. So thanks for the question, and I'm happy to elaborate on any of those points at any point.
Yeah, I'll definitely ask you to elaborate on some of those points and more as we move forward. Professor Peter, you're the architect of the Taichung statement. Do you want to add anything to what Diane said about, why this particular statement is important and how it links to the Ottawa Charter and the Shanghai Declaration? Is there anything you would like to add? And then I might come to Stefan, who has just joined us from Belgium, I think.
Samantha, do you ask Dan or ask me?
Yes, I can hear you.
Well, I'll echo most of the just mentioned Peter channel. I'm one of the founders for
Peter, we may come. Your internet's just breaking up a little bit. We might come back to you when your internet is a bit more stable.
Okay.
Stefan, do you want to add something just until we can get Peter into some better bandwidth or internet connection, just about the link between the statement and the Ottawa Charter and the Shanghai Declaration? Oh, you're on mute.
Yep.
There we go.
Sorry for joining a bit later and for being unmuted. I think this is an important event. This is an important statement. I think it puts together very well where we are in terms of the development of health literacy as a component of health promotion. And I think this is very important to emphasize that. I think health promotion is part of health literacy is part of health promotion. It's also more than health promotion. And I think we've seen health literacy develop over the past decade or two into almost a world of its own. And I think one of the achievements of the statement is that it brings the two lines of development more together. And I think that's important because we need health literacy within health promotion. And we also have to make the distinction between health literacy and health promotion. So I think it's really key that we emphasize both. And so in addition, of course, the things Diane just underlined in terms of building the further capacities for health literacy and for health promotion, I think this statement adds to and gives direction to how we can go on with that, and of course develop and further strengthen the place of health promotion within public health.
I know you spoke at the conference a lot about some of the challenges we have for us and the areas that we can improve, and I'm going to loop back to that a little bit later on. So I'll get you to start thinking about that now, because I think some of those things about what we can improve on are really important as we start to move forward. Tien, you also were involved in the development of the statement. What do you think the Taichung statement adds? Can you talk a little bit about what you think it brings, or that's more explicit or develops on earlier health literacy frameworks?
Hi everyone, thank you very much for joining us, and thanks for the questions. I'm Duyen, I'm now president of Asian Health Literacy Association and also the associate professor at Taipei Medical University here. First, thanks for joining us at the 11th AHLA Conference, which we gather a lot of people from different sector, different discipline to join us, to share about health literacy, to share about their work. What we add into those statements is that we show our capacity in terms of the education and research in Asia. We add to the puzzle, some of the puzzle to the whole pictures, and also the picture here, I mean, is about the Ottawa chapter and also the others. So here we and also Shanghai Declaration. So Taichung health literacy statement add what got more perspective in Asia. And one of the things I'm interested in that we promote, we work with the government and also the healthcare system in different countries. We have visited several ministries in different countries, and also especially in Taiwan here, we also have supported from the government, local government, and also even the president of Taiwan also support this. And we understand that health literacy is very important to play important role in promoting people's health, and also to upgrade the platform that can serve people better from the community to the higher level, and to take less burden on individual level. Just like Diane just point out that we not just only put on the burden on the individuals, but also to leverage and upgrade the system that can have can provide better for the individual and the community, so that we can create a healthy planet and people. One of the things we emphasize here during this 11th AHLA Conference is that we talk much about the digital platform. We talk much about the AI and how this can play in improve our health and well-being. So one of the things we expect that we can have is about we can integrate health literacy into the system accreditations. One of those is about the hospital, the healthcare system, and hope that this voice can be heard by the government and policymakers, and someone do a change in our system. And those are amongst of the things that we want to add. And I hope that this voice can be heard by many.
The things that was most interesting for me at the conference was just to see how many researchers and practitioners were working together with government, and government was facilitating, a range of either funding or opportunities to embed health literacy in a number of different settings and systems. And it was really interesting for me to hear from so many countries, whether it be Israel or Malaysia or Taiwan, to see how many researchers are working really proactively with governments to actually start to embed health literacy within the system, within the healthcare system. Diane, I wonder if you could maybe, I could kind of throw to you now, because you were one of the researchers who talked a lot about some of the things that were being done in practical kind of settings with health literacy. And so I'm wondering if you could think a little bit about how the statement kind of helps us to think about health literacy from a practice and implementation perspective, and the importance of health literacy not just being a theoretical concept, but embedded into practice as well.
Okay, thank you for the question. I think it's really a very important way forward that we think about what we do with our data and how we apply it so that we are driving practice and looking at outcomes, health behavior outcomes, and that we look together at what are the other interventions that are taking place and what can health literacy add to that and contribute. So I think that what I would say to your question is that we have to bring the concept of empowerment and health literacy as a skill into a focus for intervention that either is taking place or needs to be initiated. There's a lot of intervention that's taking place already that supports health literacy. For example, health education, when it's done with evidence-based models. And also when we're looking at the way in which information settings are becoming more and more accurate, perhaps, and listening more and more to what people's needs are. But having said that, I think we really have to do much more in helping people sharpen the skills about understanding where health information is coming from. What are the sources of health information? Are those sources sources that have people's health in their interest, or are there other interests? For example, commercial interests or commercial determinants of health, Samantha, which you are an expert in. So I think what we're the coming of health literacy, as it were, is that we really want to make sure that we're helping people with the skill of critical health literacy, which means that again, explore the sources of the health information that they're getting, look to see if it's appropriate for them. We have to work more about understanding about misinformation and issues of infomedia. I think the corona pandemic, the COVID pandemic, really woke us up about the importance of increasing the awareness of the population, organizations also who are promoting health through health information and health resources, that we need to make sure that we're accurate, that we're understanding people's needs, and that the interventions themselves are being piloted, are evidence-based. There's a lot of information going one way, and much of it is not culturally appropriate, has not been tested, it has not been adapted culturally. And also, as mentioned before, we haven't enough worked with professionals, either in their basic training or in their continuing education, about their health communication skills, whether it's with individual patient and their family, whether it's in community, or whether they are going online, or whether they're in the media. So, I mean, there's different levels of practice that we have to pay attention to. And if we want to go into an implementation model, then we look at the different layers of where we need to work for intervention. Some of it's already there, and we just have to improve on it and maybe even research the effectiveness. And other types of intervention we have to create with all the new tools that we have now that are coming out so rapidly, and we have to be on board as fast as the media is to improve people's health.
Professor Terry, are you online at the moment? Can you hear me?
Yes, I'm sorry, I was occupied with another telephone. Yeah. So
it doesn't matter. It's lovely to see you.
Yeah.
Do you have anything to add about the statement and the importance of the statement?
Yeah, I think I'd like to add one point is the population we are targeting for. It seems to me we need to pay more attention to the youngsters, young generation, because they were born in a AI era and they are so-called digital native. So in terms of spreading the information, the overwhelming information, we need to pay attention to how we're going to impact these generations. And I think this is the point I like to make. The other point is, as I'm a hospital supervisor, I currently face a very huge challenge. I don't know whether it is also the true in Australia or Israel. Taiwan is facing a lot of medical professionals are fleeing. They are moving away from the health industry. And I think the important point is to make some improvement in health environment, specifically for the health professionals is important. Though we are talking about health literacy, we need to have the so-called the messengers, the ambassadors who are delivering these important information, and also to make people believe and empower people to behave what they've known when we teach them. So this is the additional 2 points I like to make, and I very much thank you for all the support and participation in Taichung conference. And as a host, I appreciate you again very much, and I hope the discussion will be have more impact in the future. Thank you.
Thank you so much. And I think you raise really great points. One of the things that has always struck me about the Ottawa Charter for Health Promotion is that it really, reinforces that health information and the programs that we develop should not be top down. They should be created with our communities and in collaboration with our communities. So we have to go to people where they live, work, and play, and listen to them and work with them to develop things that are relevant to them, in their kind of local social context. And one of the things that I think is very interesting about young people is that we don't do enough to actually collaborate with them. We talk at them a lot, but we don't listen and talk with them and include them in the development of our programs. So that for me and the work that we do here in Australia is central, that we're actually listening to young people, we're listening to how they would like to receive and create information with us. And I think, that's how we build trust with communities. It's not just through the facts, it's actually through building relationships with them. And
Exactly.
That's the most effective way that we can, So Professor Peter, I don't know if your internet is stable now and if you had anything else you would like to add, and then I'm going to come to Stefan to ask him to give us a bit of a summary of some of the things that he said at the conference about where we could improve. I can hear you, Peter.
Oh, maybe Stephen, you can go ahead, and after that I will follow up.
All right.
Yeah, thank you.
Stefan, so now I'm going to throw to you quickly. So I guess I just wanted to ask you to reflect on how the statement can be used to support some further accountability and longer term structural change. And I was really struck by many of the things that you said at the conference about what we could do better and how we have to start thinking about those systems and structures and how we get some movement within them. Just wondering if you could talk a little bit about that for the benefit of people who will be watching this back later on.
Well, thank you. I think indeed that the statement, one of the real strengths of the statement is that it very succinctly puts forward the essence of what is health literacy. And also what it is not, and it's in this line that I think we should also be sufficiently critical as a health literacy community and health promotion community to reflect on what we do and what we can do and contribute. And I'd like to make the link indeed with some of the criticisms that have been heard also in the past with regard to health literacy, notably from the health promotion community. And as you mentioned yourself, health promotion is much more than information sharing. It's much more community building, and there's an awful lot more about it. And what is sometimes criticized about health literacy is that this takes us back to good old-fashioned health education, where we give information and we hope people will change their lifestyles and improve their health, which of course is very naive. And I think we should be open to that criticism. I mean, there was an editorial in The Lancet, so not the least of journals, not so long ago, that basically put that forward. So we're not talking about potential criticism, we're talking about real criticism. And I hear that very often in the health promotion community too. Now, I think if we go back to the Taichung statement, there it's really clear that we're not talking about information sharing, we're talking about people's competences, people's capacities to deal with information, to process information on health. And I think this is key, that we keep on voicing that, and that we can keep on emphasizing this and be very precise about it. And the statement really helps in that, because it helps us to also get rid of the criticism that we're putting the emphasis and the responsibility back on the shoulders of patients and of citizens. I think we should indeed not do that, obviously not. And I think especially, and I refer to what Diane said before, the importance of critical health literacy as one of the components of health literacy is becoming all the more important with the advent of social media, of internet provided information, digital health literacy. I think this is absolutely key. So there's not a manco or a deficit of information. There's too much information, so we have to strengthen people's competences to deal with too much information on health, and to help them to basically deal with that information. So that's one of the criticisms I think is important. And I like to also refer to what Duong said with regard to the need to not only look at people, but also look at the organizations and the settings. And so there we see, and that's again emphasized in the statement, the importance of organizational health literacy over the past decade or so, that really has emerged and is getting more and more attention. And I think that's a way to go forward. So this is one of the points indeed.
And can I just ask you, for people who may not be so familiar with critical health literacy, just to talk a little bit about that and what it is. We are next year at Health Promotion International, we have two special collections. One is on the Ottawa Charter, and the second one, which will launch earlier in the year, will be a call for papers on critical health literacy. So I'm wondering if you could perhaps give a brief summary of your take on what critical health literacy is, just to give people some context, particularly in areas where they may not be as familiar with social movements, or that may not be as part or as established in cultures as they are in perhaps places like Australia.
Well, I think in a way, it's not my take. I think it's a take that has become more and more generic. I think if you go back to the basics of health literacy as a concept, it's about the capacity of people, or the competence of people rather, to find information, to understand it, to critically analyze it, and to apply it. And so this could be patients, this could be citizens when we're talking more about public health. And so it's actually a set of competences that people can have. And so the critical one is really to look at information critically, because not all information that is available, even also from health providers, is equally valuable and complete. And so this is basically what it boils down to. And so it means that people should be encouraged and helped and given the skills and the possibilities to look at information. Where does it come from? Who is behind this? I read something online about, for example, how to deal with this or that disease or problem. And so is there a commercial interest behind it potentially? Is this coming from an unsuspicious source? So this is basically what we are talking about. So it's a particular skill. And again, this links to the basics of health literacy. And I like to refer to Don Nut-Beam here, who in his model made the distinction between the functional health literacy, which is what we see in 80% of the cases when we talk about health literacy. It's about the possibility of accessing information and to really to get information about functional aspects of managing disease and health. But then the communication, so becoming much more interactive and daring to ask questions, possibly also a second opinion and so on. And then the critical health literacy, where it's really about who is behind this information, which source, how complete is it? And so I'm not only talking about fake health news, but also about probably information with the best of intentions, but that's one-sided or has an interest behind it. And so I think we need to become smarter at dealing with these kinds of information.
A great response. Thank you. I appreciate you explaining that for people who may not be as familiar with that part of health literacy. Diane, I'd like to come to you now, really looping back, I guess, to something that Professor Terry said, which is kind of about children, but also thinking more broadly about the role of health literacy across the life course. So this statement places emphasis on education, self-care, and health literate systems across the life course. Where do you see the greatest opportunity for impact? Is it in schools, health systems, or communities, or is it a mixture of all of those things and more? Oh, you're on mute, Diane.
Oh, okay. Yeah, I think the answer to the question is in your question, but I'll elaborate. I think what we see is that on the one hand, we're looking at special populations. When we do the research on the surveys, national population surveys, we've seen across the board when we look at measuring health literacy and the different measures that we have, whether it's with the WHO Action Network on measuring organizational and population health literacy, MPOL, or whether it's other HLS measurements, we're seeing that populations that are emerging as with special needs are particularly those with financial deprivation. For example, that when we do intervention, we need to also make sure that we're not leaving anyone behind because of those needs. So on the one hand, we're looking across the board at those where there's, because of social determinant of health, for example, financial deprivation. In some of the countries, it's also education levels, but not in all countries. So we want to make sure that we're focusing on those who have greatest needs. And then, as you mentioned, in parallel, looking at the life course, at building on the concept that health literacy is an asset, the asset model and not a deprivation model. So when we talk about an asset, health literacy as an asset for health, then we look at the life course, whether it's looking at children, kindergarten, younger children, whether we're looking at adolescents. There's a lot of research been done on adolescent health promotion. We're looking at it through a health literacy prism, and we can quote that, adults, and then also older adults. I'm acknowledging two colleagues that are here with us from Israel who happen to be also experts in work that we do on in looking at health literacy in childhood, early childhood, and also in elderly. Dr. Onita Yakubovich and Professor Efrat Netter. So I'm so happy that when I sent the link out that they joined. The research that we're doing together is really showing that it isn't an issue of life course. There isn't one area and one period in the life course. I would say that we have to say that is the life course. That's where we should focus. We need to go through the entire life course and see what the needs are, what people's capacities are for improving health literacy, for their health promotion, and work through the life course, which means that we're mainstreaming health literacy. We haven't really talked enough about integrating health literacy into other areas that are high-level strategic areas. If we're looking at NCDs, or if we're looking at the issue of infectious disease, where's health literacy coming into place? What about in the emergency strategies the countries have for all sorts of reasons? Where's health literacy there? We're learning more and more that health literacy, on the one hand, it has its own issues, as Stefan said, for research, for policy, and for practice. And also in parallel, we have to make sure we're including ourselves or initiating or being proactive in bringing the health literacy contribution to other strategic areas throughout the life course. And also when we talk about issues of disparities and closing the gaps financially, or for those who have financial deprivation for health, where's health literacy going to contribute there to help closing the gap? So I think we're looking we're looking at the life course model. We're looking at the settings that help us bring health literacy and capacity building for health literacy into the different life course, whether it's schools, whether it's even before schools, if we're looking at daycare settings where we can reach parents, whether we're looking at kindergartens, schools, high schools, youth settings, as Terrence mentioned, much of the work that we need to do, and we are doing, but maybe not enough, with adolescents is not necessarily in the formal settings, whether it's on social media, or whether it's in community settings for adolescents. What about workplaces? And but also between the universities, we're working on a project now in university, health promotion universities, and bringing health literacy into that area as well. And then, of course, older populations and elderly. And elderly, for example, is not just one population. If we're looking at 60 or 65 plus, it could go up to, we know there's about 4 decades there. And also, this is an opportunity to acknowledge the work that we've done, Israel and Taiwan, in our binational study with Tuan and with Peter and their colleagues in Taiwan, and in Israel, a colleague with Professor Efrat Netter and Orna Baron-Appel and myself, looking at what the barriers are. When you talked, Samantha, about listening to the population, listening to people, we listened to those who are 60 plus, 70 plus, 80 plus. What are their barriers for using digital health resources? And they talked about the issue of security, of data security. They talked about the issue of trust and being able to believe that those who are giving them information and offering it to them, that they might not be able to trust. So maybe that is a barrier as well. And that links up with what Stefan mentioned about critical health literacy. So just to sum up, on the one hand, we're looking at health literacy throughout the life course, and we're also flagging those populations who already understood are challenged more with health literacy, for example, those with financial deprivation. And that just brings me to sum this up and say that we really need national action plans for health literacy. And some countries have really gone forward with that. Australia, we'd like to commend Australia for having a national action plan. Norway, Portugal, German-speaking countries. Other countries have begun or in the past had a national action plan and maybe did not support it enough. But if we have national action plans, then we have all the stakeholders on board so that we can really understand what the needs are and a systems approach. And I think that kind of brings it all together. And the Taichung statement mentions this in a very, very focused way.
Thank you so much, Diane. It's a really comprehensive answer there. So thanks. Lots and lots of things for people to think about and consider. Tien, can you maybe talk a little bit about some of the things that you have seen in the Asian context about embedding health literacy sort of in community settings or throughout the life course? What are you seeing in your work?
Thank you for calling me back in this question. I have been working with health literacy for more than 10 years, 15 years already, and start from very beginnings that very few know about health literacy, and they may misunderstood about maybe just knowledge. And even lately, some people just think health literacy is a health knowledge, simply. But one of the things I learned from my journey is that so much diverse in Asia. It's not just like in the United States, everyone speaks in the same language, most of you. In Europe, you also speak some in English, some in Spanish, or some other Dutch or so, Germans. But in Asia, we have a lot of the languages. Even in one country, we have like 10 or even 20 or even more languages in one country. How we can use the same term and they understand as the same thing for health literacy. So that is the big challenge for us here in Asia. So a lot of languages and culture is so diverse. Culture from Taiwan on in China, some speak in Chinese country, or some speak other language country, India, Indonesia, Philippines, and also religions, a lot of them. And we have a lot of the religion, cultures, right? And also political issues. There's a lot of the country have different political system, and this also affect to how we're going to implement and how we're going to promote health literacy across the country, across the region, across different area in the same countries. So that and also the geographic profile, in mountain area and so in the delta area, many different, and also the economic range. We have a top country with a very high income and some very poor. It's not homogeneous population in Asia, but it's so diverse here regarding so many aspects, and that would decide their medical practice, their healthcare practice regarding to their culture, their belief, their political, all of those, they practice differently, and they understand health literacy differently. They perceive health in different way. And we have the religious health also, spiritual health, not just only the physical and mental health. So you see that many part of our health were affected by the local tastes. The local perspective here. So health literacy is serve people and serve the healthcare system, but the way they perceive that, the way they take it and put it into the action is the big challenge for us as an advocate and pioneer in promoting health literacy across Asia. And also, but however, we still have some achievement here through the years. We do that people start to realize that health literacy is very important, and they play very important roles in even their daily practice, and also to have people have better health literacy and better health. Okay, so health literacy in this one goal for everyone, and also to serve the people, serve the planet. And lately, we just realized that there's many countries start to put the health literacy into the agendas. It's not really nation action plan, just like Diane mentioned, but they put them into their agendas to improve their practice, improve their education system, and also others system to help people. So those are the things that I like to share, and just let you know that we still have a lot of challenges to overcome in the coming year and in the future.
Thank you. That was a great answer, and really important for us to recognize that, that in some countries, or many countries in the world, we are working with such diverse populations, and their knowledge is socially constructed and situated and based on so many things. So thanks for that incredibly important reminder. So we're just coming to our last couple of questions. Stefan and Peter, and maybe Professor Terry, would you like to reflect on how health literacy can help counter misinformation and disinformation while also rebuilding trust in public institutions and systems? Who would like to go first? Stefan, would you like to go first? And then maybe we can come to Peter and Terry.
Yeah, thank you. Well, I think it links again with the idea of critical health literacy, but I think it's a very key question. It's not an easy one, of course, because we know that health promotion and health literacy are very political, and I like to look at it through the perspective of a political psychologist as well. I think we have to understand that trust is essential for democracy and is essential also to health promotion and health literacy. I think we need trust in order to be able and to foster health literacy and health promotion. I think the two are intertwined completely. And so in this regard, I think health literacy needs trust, because otherwise I think we are really in trouble. At the same time, health literacy can help build trust. I think if we've strengthened people's competences to deal with health-related information, I think that's key. But I think we should also realize that it cannot only come from the health sector. I think we know for decades already that health is not only influenced by the health sector, but it's basically intersectorial. And so I think we need to also contribute to the building of the trust in other sectors. I think we can, because health is an element that also politically is very important and is one of the entry points that many politicians will also emphasize to get access to the population. But I think we need to understand that in order to be able to build health literacy, we need to also build political literacy and political trust. So I think these two go together.
Great point. Peter or Terry, do you have anything to add to that, kind of thinking about the role of health literacy and countering misinformation and building trust?
Oh, I like to first of all, I 100% agree with Stephen just mentioned, and I recently very often talk to my students in the medical school that we are living in a very high-tech era. With technology, it seems to be dominating in terms of knowledge, skills. But as a medical student, the health literacy advocate in the future, they should learn human touch is also a very important during their journey becoming a doctor. So you're talking about trust. I think we should invite more human touch to be able to build the sense of trust. Much rely on technology cannot achieve a real trust. It's a virtual behavior or something like that. So I would like to go back to the basic. Even in a very high-tech era, we need to build up the human relationship with caring and touch and association with peoples, not on a virtual world. This is how I feel about how we're going to rebuild the trust, especially to the next generation. Thank you.
Well, maybe
To add?
yeah, to catch up, but also add, but also to come to why we have this Taichung statement. 40 years for up to the Ottawa chart. And in the beginning, they already light up this potential important. And Shanghai was 10 years ago. So it's between now, it is a lot of, and in Shanghai Declaration, they talk already something about, which is quite important nowadays, national program and local programs on health literacy. This will be implied for critical health literacy or education, Stephen and Terence just mentioned about, and also use the digital technology to empower citizens. But in Shanghai Declaration, we don't know about the AI will be useful in our daily life. But now it's the era air. And so it's 10 years. We have a lot of important development in the society and culture and civilization, but we are now having more power or more responsibility on health literacies. And the healthy choice are also mentioned in Shanghai. So I see that one of the important thing in Taichung statement is that we adding education as one of the key points for the next steps we have to work with. And also the second one is about the evaluation and monitor the health literacy information system or the system in the nation level or in community is also important. I mean, all of you mentioned about how we can make the trust back to in the communication is very, very important. And but we don't have a hospital or system accreditation yet when we're doing this health literacy promotion, which is might be important. for Taichung statement to bring that up. And European have MPOL and health literacy organization can take more actions and to be entrusted to do the coming follow up. So I think that is a few points we didn't face that in before, but now we're going to deal with that. So Taichung Declaration, Taichung Statement is actually something we need to work on that in the coming before we are out of the order. Everyone knows that we have too much information. Terence mentioned that we cannot control it. Now we are thinking the kids early childhood education is so important. Like we like to know what Australia would reach that we can share with your experience with us. So that would be also very important. Maybe in Taiwan or Israel, other country, we would learn and modify it. So back to your that why we have this Taichung statement to start with, but also besides. Showing us the roadmap ahead, but there are some critical area we really need to identify some solution, like the misinformation, disinformation, and actually, I just share with you UN Declaration on Mental Health and NCD, and also mention almost the same thing like we just have discussed. So I believe that we know we create this, and we already have a health literacy program around the world. But are we ready to helping or too late? That's the question. I think we have to think of that. How can we really activate more resources in the community and national level, and how to helping the after Ottawa Charter is health promotion part of a very important homework we can take in. Thank you.
Thank you so much. So we just have a couple of minutes left, and to close, I'd just like to ask each of you to very briefly share one priority action you believe is essential over the next 5 years to advance health literacy globally. So a very short kind of one thing you think we should focus on moving forward or have as a priority moving forward. Dan, would you like to go first?
Okay. I would say that if we're one priority, I would try to be as comprehensive as possible.
Brief.
I think it's really, exactly, I know, even less. I think it's really important for us to look globally, because we're going to act locally, but we also have to look together globally. And I think the Taichung statement needs to be meshed and aligned. We can align the other global initiatives that we have on health literacy. International Union of Health Education Promotion has a very strong advocacy statement for promoting global health literacy, and a position statement on health literacy or promoting health in a health literate world. We're happy to share that. WHO has global work and some others. So I think if we continue the conversation globally to exchange experience, to support each other, and that could be maybe a top-down discussion, but also continue to develop the tools for bottom-up, for community, for listening, and meet the bottom-up and top-down efforts together, and keep this conversation going.
Thank you. Thank you. Stefan, what would your one priority area be?
Well, I think to continue on what Diane said, I think we have to continue developing. I think it's a long process, but I think we have to keep on going. We have to realize Rome was not built on a day or in a day. And talking about Rome, that's my statement or my suggestion, actually. Just beginning of December in Rome, there was a meeting on health literacy as a human right, organized by the Council of Europe. And I think this is an important element to include and to contribute to.
Good.
Thank you. Terry, if you had one priority area, what would it be?
My priority would be we need to educate and invite more people to get on board. Because health literacy, we need to every walks of life people to join, and it would be a long I would say it's a long journey, but we are on the road and we still have to keep moving. Thank you.
Thank you. Tien, what would your one priority area be?
Very short, we provide health literacy for human and AI. So that is the key message, because we are not just only human, but now AI is integrated very much in our life. So we need to provide health literacy for AI also. And the last from me is that welcome to join us next year conference in Thailand, in Chiang Mai for 12th AHLA Conference. Welcome.
And Professor Peter, what would your one priority area be?
I will try to set health literacy involvement, intervention, education as early as possible. I mean, we used to say that it could be used in university, but now I think in the social media, we need to start as early as possible. Early education, adult, family education involved in health literacy. Thank you.
Thank you. Well, just to sum up, I'd just like to thank our panelists for such thoughtful and engaging contributions, and to those of us who have joined us today on a weekend and in holiday period. So I thank you very, very much for joining us. And I think for me, this discussion reinforces that health literacy is not simply about information or individual skills. It's about power and participation and the systems that shape health across the life course. So for those of you who watch this back later, we hope today's conversation supports your work in research, policy, practice, and advocacy, and helps to move some of these global conversations into action. A big thank you from me. I'm Professor Samantha Thomas. Please have a look at our Health Promotion International special collection on health literacy, which we'll be launching the call for papers for next year. And a huge thank you to the Asian Health Literacy Association for facilitating this conversation today. And as someone who went to my first AHLA conference this year, I can endorse it 100%. It is the most fun, friendly conference I think you will ever attend. So I hope to see you all next year in Thailand as well. Thank you very much, everyone.
Thank
And
you
we
so much.
have a happy holiday.
Thank
Yeah.
you.
We should
Thank
take
you.
a good
Happy and
photo.
healthy New Year
We
to everybody.
should take a good photo.
Yeah, Happy New Year.
Happy New Year.